Hi, this is Dr. Nick from the ECG Academy, and we're going to be talking about the three-dimensional anatomy of the heart because the ECG gives us a lot of information about different regions of the heart, and in order to understand these regions, one needs to have an appreciation of the three-dimensional anatomy. So the bottom chambers of the heart, which are the pumping chambers, we call the ventricles. There's a right ventricle and there's a left ventricle. And it turns out that the right ventricle is really more in the front of the heart because the heart's kind of twisted in the chest. So the right ventricle is on the front, the left ventricle is on the side and kind of behind the heart. The top chambers are known as the atria. There's an atrium on the right side, and there's a left atrium, but you can see part of it on the left side, but most of the left atrium is actually behind the heart. So now how does the blood flow through the heart? Well, the veins from the body, including the superior vena cava here and the inferior vena cava coming from the bottom part of the body, empty into the right atrium. The right atrium is a thin-walled sac on the top of the heart. The muscle here is very thin. And then the blood from the right atrium goes across a valve into the right ventricle. Now this is a tricuspid valve. It has 3 leaflets. And the valves in the heart keep the blood flowing in the proper direction. So when the ventricle contracts, the valve closes and keeps the blood from going backwards. Once the blood is in the right ventricle, it needs to get out somehow. And this is the pulmonic valve that actually leads to the pulmonary artery and then off to the lungs. The venous blood that returns to the right side of the heart needs to be reoxygenated. The blood goes up to the lungs and gets a fresh supply of oxygen, and then it returns to the left atrium through 4 pulmonary veins. There's 2 on the left side and 2 on the right side. These pulmonary veins empty into the left atrium, and the left atrium, like the right atrium, serves as a storage sac. It's connected to the left ventricle, which is the main pumping chamber of the heart, through the mitral valve, which has 2 leaflets. The left ventricle pumps to the whole rest of the body, and once the blood enters the left ventricle contracts and the blood has to get out to the body, and it does so through this valve in here, known as the aortic valve. The aortic valve has 3 leaflets and leads to the aorta, which is the main artery in the body on this model, is right here. So in terms of anatomical regions, let's get some orientation here. The heart hangs from the great vessels with the apex of the heart pointing off to the patient's left side. The right ventricle is in the front. We can see some right ventricular events, but we're mostly concerned with the left ventricle because that's where most heart attacks occur. The front part of the left ventricle is known as the anterior wall, and you can actually see an area of fat here, which is the anterior interventricular groove. It's the groove that separates the right ventricle from the left ventricle. And deep down inside that groove, you'll find the septum, which is the thick muscular wall that divides the 2 ventricles. So you have the septum, you have the anterior wall of the left ventricle, you have the apex, as I mentioned. The lateral wall of the left ventricle is off on the side here. The inferior wall of the left ventricle is on the bottom end, sort of against the diaphragm of the body. And the posterior wall, which is the back side of the heart, you have to twist the heart around to see the posterior wall of the left ventricle right here. Different coronary arteries supply blood to different regions of the heart. And when we look at the ECG for ideas of what coronary may be affected, we need to know what these anatomical regions are. So that's the discussion of the three-dimensional anatomy of the heart. I hope you enjoyed it. And stay tuned for the next video where I'll talk about the internal anatomy of the heart in more detail. And then I'll talk about the cardiac conduction system and where the ECG comes from and how we start to analyze it. Thanks for watching.